discuss the liver segments. Regarding anatomy of the liver segments, ultrasound evaluates liver anatomy in multiple planes. Ultrasound can precisely localize a lesion to a given segment, and each liver segment has its own blood supply, including arterial, portal and hepatic, venous, also lymphatics and biliary drainage. Liver has 8 segments. The right, middle and left hepatic vein divide the liver longitudinally into 4 sections: lateral and medial sections of the left lobe and anterior and posterior sections of the right lobe. Each of these sections is further divided transversely by an imaginary plane through the right and left main portal branches. Portal vein is formed by the confluence of the superior mesenteric vein and splenic vein. It supplies almost 80% of hepatic flow. Portal branches radiate from the porta hepatis, where the main portal vein enters the liver. Portal vein divides the right and left branches, which run horizontally in dividing liver sections into superior and inferior segments. Hepatic veins are 3, draining blood to IVC. And hepatic veins divide the liver into 4 functional segments. RHV divide the right lobe into anterior and posterior section. The middle hepatic vein is separating right and left lobes. The left hepatic vein divides the left lobe to the medial and lateral segments. If we consider the right hand fist with thumb behind the finger and consider the fist as liver for a while, the interdigitory spaces represents each hepatic vein dividing the liver into 4 sections. The caudate lobe is represented by the thumb posterior to the other fingers. Here it is highlighted with a yellow color. Portal vein branches are dividing each section to superior and inferior segments. Like here, the red line is dividing each chamber to the superior and inferior parts or segments. Overall, if we label these segments, in this image, the caudate lobe is not shown as it is lying behind the other fingers. The caudate lobe is called segment 1. The segment 2 is lateral segment of the left lobe superior. The third is lateral segment of the left lobe inferior. The fourth is medial segment of the left lobe. Some authors are dividing it to the 4A and 4B segments. The fifth is anterior segment of the right lobe, which is lying inferiorly. The sixth is posterior segment of the right lobe, which is also inferior. The seventh, posterior segment of the right lobe, in that is lying superiorly. 8 is the anterior segment, which is lying superiorly. Sometimes the question arises as to how to differentiate the portal veins from the hepatic veins. Here are a few characteristics that we can discuss. One is orientation. Portal veins are horizontal and hepatic veins are vertical. Echogenicity. Portal branches are within portal triads along with hepatic artery bile duct branches. Portal triads are surrounded by fibrous and fatty tissue, therefore appeared echogenic. The location. Portal vein branches run the middle of the liver and are called intrasegmental vessels. Here is one exception, that is umbilical segment of the left portal vein that runs between the lateral and middle segment. Hepatic veins separating the four segments from each other in called intersegmental vessels. The last characteristic is flow. The portal vein has flow toward the liver, which is called hepatopetal flow, while the hepatic veins has flow away from the liver, which is also called hepatofugal.